At MD Anderson Cancer Center, research is at the core of our mission to end cancer. Research helps find better ways to prevent, diagnose, and treat cancer. By donating your tissue and sharing your clinical data, you may help researchers gain knowledge about cancer to help people in the future. Tissue may include tumor samples, urine, blood, saliva, or skin. When you need a medical procedure, such as a biopsy, surgery, or a routine test, your doctor may collect tumor samples, blood, saliva, skin, or other tissue. When testing is complete, there may be some leftover tissue that was not used. Doctors often destroy and get rid of this leftover tissue. You choose whether to donate your leftover tissue for research. Tissue samples hold information about your body, including cells, genes, and proteins. Researchers can ask and answer a lot of questions using your tissue and data, including cancer risks and differences in patient responses to treatment. Talk to your doctor if you'd like to find out more about tissue donation. The research team will contact you about tissue donation. Your choice will not affect your medical care. Be sure to ask any questions you may have after watching this video. If you choose to donate your leftover tissue for medical research, your leftover tissue will be stored. No extra tissue will be taken for research. Researchers at MD Anderson may then use your leftover tissue to learn about cancer. Researchers can also learn about cancer by studying data from cancer patients. Your clinical data is the data in your medical record. This is information that your clinical team collects as part of your care. This information may include your medical records and test results. Your information and leftover tissue will be securely stored and managed using a database at MD Anderson. They are stored for an unlimited time and can be made available to use in research studies about cancer and other diseases. There are state and federal laws that help keep your information as safe as possible when it is used for medical research. MD Anderson takes careful steps to follow these laws, protect your privacy, and make sure our researchers follow state and federal regulations. Before your information can be used for future research, the researchers must get approval from an Institutional Review Board, or IRB. The IRB is a special committee that is responsible for reviewing and monitoring human research studies. When you donate tissue for research, there are a few risks to you, including the risk of the release of your personal information. MD Anderson makes every reasonable effort to keep your information safe, but cannot guarantee complete privacy. You can change your mind about tissue donation and stop donating at any time. If you want to stop tissue donation for research, talk with your care team. Your leftover tissue samples that have not been used by researchers will be destroyed, and MD Anderson will stop storing your leftover tissue. If you decide to stop donating your tissue for research, some of your leftover tissue samples may already be involved in a study. These samples and your information will not be returned or destroyed. Your data will be kept after it has been used. However, if your data has not been accessed for a study, then it can be marked so it will not be used in the future for this study. There is no cost to you for donating leftover tissue or allowing access to your clinical data, and your medical care will not be affected by your decision. You will not be paid for donating leftover tissue or sharing your data. If you want to donate leftover tissue for research, you will be asked to give your consent or permission in writing. By giving consent, you agree to store your leftover tissue and information to be used in future research. Donating tissue for research is your choice. You need to know what to expect so you can make a decision based on your values. Share this video and talk with people you trust. Ask your care team any questions you have. The following 3 questions review key points about tissue donation and data sharing at MD Anderson. Am I required to donate leftover tissue or allow access to my data for research? No. You are not required to donate leftover tissue or allow access to your data. Donating tissue and allowing MD Anderson to use your data for research is your choice. You do not have to do either. Your choice will not affect the medical care you receive. Do I need to give consent or permission to donate tissue or allow access to my data? Yes, you must give consent. Giving consent means you give your permission. If you want to donate tissue or provide access to your data for research, you will be asked to give consent in writing. Can I stop donating tissue and allowing access to my data at any time? Yes, you can stop at any time. You can change your mind about tissue donation and sharing your data at any time. If you choose not to consent to donate your leftover tissue or allow access to your data for research, a member of the research team may reach out to you to determine if you have any questions. You can email any questions to halresearch@mdanderson.org.